they'll say this is the number of COVID cases and it keeps on going up and up and up. But then when you, and like the COVID deaths, but when you actually look at it, they're categorizing potential COVID patients as having died from COVID when they're not even confirmed. People who would have been classified as dying from pneumonia, heart disease, hypertension, if they had COVID, that's what they died from.
Well, folks, if you believe the Wuhan virus hype perpetuated by so many in authority and those in the media, well, you'd think that the hospitals of the world are overflowing with those infected with the coronavirus, that emergency personnel can barely keep up with the demand of patients, that the healthcare system is virtually fraying at the seams. But is that entirely true? Well, folks, my guest in studio is a nurse who works at an Ontario hospital, and she paints a vastly different picture of the situation on the ground. In fact, at her hospital, personnel are so bored because they have nothing to do. They're actually being paid to go home early. I know it sounds so unbelievable, yet she asserts that this is indeed the truth. Now, before I introduce her, we are not going to reveal her real name, nor the name of the hospital she works at, or even the municipality the hospital is located in, because that's how things roll these days, folks. When you speak out in an unauthorized way, the end result is perhaps termination, and we certainly don't want that to happen to our whistleblower. So without further ado, let me introduce my guest, who I shall refer to as Jill. Hey, thanks for dropping by Rebel Headquarters, Jill. I hope you're doing well.
I am, thank you.
Fantastic. Now, Jill, we're supposed to be in a pandemic crisis, and one would imagine from the media coverage that the hospitals are war zones, but that's certainly not the situation in your case now, is it?
No, if anything, I find that the hospital has never been so quiet. And I've been in touch with a lot of people from different hospitals, just trying to find out whether or not they're jam-packed, whether they're at regular capacity, whether they're below. And the majority of them, I would say they're either functioning as per normal capacity or 60 to 70%. When I go into the hospital, I do see a lot of nurses sitting around waiting for things to happen because I believe that a lot of hospitals have designated potential COVID units. For example, elective surgeries, those have all been canceled now to protect people from COVID, but they're now using those units for people that they're expecting to come in with COVID who need to be hospitalized. And that just hasn't happened. There's not this huge influx of people who need ventilators or oxygen, and we're just kind of continually waiting around for this situation to happen.
And Jill, just to be clear, I think in one sense, this is very good news that your hospital, other hospitals aren't overflowing with people on ventilators. They feel like they're drowning, they're fighting for their lives. That's fine. But on the other hand, you mentioned the elective surgeries have been canceled or postponed, and we should be clear about that. An elective surgery doesn't mean, something like cosmetic surgery. I mean, it's something that could be very important. And what has been the effect on those patients that have postponed this elective surgery? Because I understand what you're trying to say is that this is unnecessary. The hospital could be utilized to do these procedures.
Yeah, I can think of a few examples for this one lady. She had cancer and she was supposed to have a double mastectomy, and now that was canceled. So she doesn't know, she can't tell her kids oh, it's gonna be fine after this date because I'm gonna have that done. So there's a lot of things that are actually, I would say, necessary. And people are talking always about the second wave of the influx after we open things up again. But for me as a healthcare professional, I'm nervous about the second wave of the mental health and the repercussions of not providing the services that we actually should be providing in this time.
Now, there is a lot of, I think, anxiety about people that have been cooped up. They've been self-quarantining. They're not working. Certainly, this must be a mental stress for so many people. Jill, I'm just curious, from your point of view as a healthcare professional, could we start to reopen the economy? Certainly there's a greater clamor every day for that, maybe on a yellow light basis, maybe on the way Taiwan has done it. You know, have people come back to work, still do the hand sanitizer thing, wear a mask, maintain the 2-meter distance, but maybe go back to work again. What do you think?
It's such a huge question to ask. The problem I find is that people assume healthcare professionals know best. And in my experience, that's not actually true, which is sad. But people, like many people who are younger, like you just read what the media is telling you. And then when I talk to my colleagues, they assume, like they get frustrated with me because they're like, oh no, like we're stopping the surge. But that's because what the media is telling us. But if you actually look at the research and the statistic as to what is actually happening, they'll say this is the number of COVID cases and it keeps on going up and up and up. But then and like the COVID deaths, but when you actually look at it, they're categorizing potential COVID patients as having died from COVID when they're not even confirmed. People who would have been classified as dying from pneumonia, heart disease, hypertension, if they had COVID, that's what they died from. So COVID goes up, the other number of patients dying from these other secondary diseases goes down. So it's kind of like even the statistics aren't showing what is actually true.
You know, you've raised many good points there, Jill. One is the fact that what I think we've learned is that models are not data. And so many of these models have been like the super worst case scenarios, which have not materialized basically anywhere in the world. But also you mentioned health professionals themselves. I seem to remember whether it was the World Health Organization, whether it was Dr. Tam in Ottawa, the narrative was, going back a couple months, there is no human-to-human COVID-19 transmission. That's not true, it turns out. Masks are not effective. Well, they flip-flopped on that too. I think maybe members of the public are losing faith in what the authorities are telling them. What's your take on the situation?
I would say that what they have done, the government has done with isolating people and then feeding them media that is based on fear is genius, because you can't get together, you can't discuss things. And I've seen posts that have been taken off of social media because it does not speak about what is in mainstream media. And so you isolate people with fear and you can manipulate them.
And meanwhile, if you look at the economic hit to the country, Jill, I mean, in the month of March alone, the Canadian economy plunged by 9%. Those are Great Depression numbers. I think there's perhaps a way to manage this pandemic with a yellow light approach of opening up things again. I guess what I'm saying, Jill, New York City is not, say, northern Alberta, right? There's so many different, factors, but yet it seems that the entire world is being treated as a large metropolitan city. And I'm thinking, based on your medical expertise, perhaps that's not the way to go?
I don't believe this quarantine is the way to go, which the amount of backlash I've received from saying that to other people is very high. But then when I give them the statistics, they're like, okay, this makes sense. So they have said that the best worst case scenario, according to the statistics, we haven't even hit yet.
Yes.
So I'm like, okay. And then the images were shown in the media. I don't know what hospitals they're showing, because I'm like, when I've talked to people who are in the GTA and up north and around Ontario, they're saying, well, we're generally at 60-70%, maybe full, but it's not a gong show running around and whatnot. So this is when I would say we're putting all this hope in the vaccine, which a vaccine doesn't even exist right now. The coronavirus has been around for years, and they have done testing on it, and the animals that it was tested on had hyperimmune responses. It was they ended up making the animals sicker in the end. So you can only imagine what that's going to do to humans, and like 1 to 2 years of quarantine for them to build the vaccine will not provide proper safety measures to even allow that to happen. An interesting fact about vaccines right now is that if you have the flu vaccine, which are most people who are vulnerable and the old, like elderly and whatnot, you have a 36% chance, higher likelihood of getting coronavirus.
Interesting.
Yeah. So I would say I absolutely believe like quarantining the elderly and the people with comorbidities and those at risk is important, because I'm like, they are at risk, high risk of experiencing the side effects and like negative health consequences. But the majority of the population, 80% of the population age 60 and lower, experience minimal to no effects.
You know, Jill, I think that's an extremely important point. The fact that when you look at who's dying, very, very few young, healthy people. It's like a statistical anomaly almost. And yet I can tell you, earlier this month, I went to the Pinecrest Nursing Home in Bobcaygeon, where you've had so far to date 29 residents plus 1 visitor to the nursing home all die. That's almost 1% of the Bobcaygeon population dying in this one nursing home alone. But let's be frank, these were very elderly people. They probably had other circumstances in terms of respiratory conditions. So again, the coronavirus, it's not a one-size-fits-all kind of thing when it comes to those getting infected.
No, it's absolutely not. And this is another thing. It's like the media is saying, look at these deaths, look at these deaths. And I'm like, as a nurse, I see death. And like healthcare professionals, we see death. But like now that it's being thrown at like the public, they're like, oh, what is this? But the reality is, I'm like, people are going to die. People die from every single day from the flu, from comorbidities and whatnot. But now that it's suddenly labeled as corona or COVID causing it, it's like the worst thing ever. And I'm like, the nursing homes, don't take me as like not compassionate, but I'm like, people need to pass on. Like, they are at the end of their life, and we continually postpone it and postpone it. If you get the flu, like, and you're old, you're gonna be higher at risk. That's just the reality of it.
Exit question: if you had the ear of the Premier or the ear of the Prime Minister, and you were to offer them some advice based on your frontline experience in a hospital as a nurse, in terms of changing things, changing procedures, what would you say to them?
I would say open up the schools, because the younger population, those below 60, are not at risk. Herd immunity is 65 to 68% of the population. We are the ones that can protect. By getting the natural herd immunity, we can protect those who are at risk and the vulnerable.
Great. Well, Jill, I want to thank you for your time and your bravery coming in here. I know you're going off the script, and we're always supposed to go through official channels, and we know how well that's worked. So I want to thank you sincerely for coming into Rebel World headquarters and spending some time with me.
Hey folks, do you feel that you've been personally victimized by law enforcement or by bylaw officers in terms of those people handing out fines for COVID-19 violations? Well, if your case fits the bill, we'll foot the bill, your legal bill that is. Please send your story to us here at Rebel News. Go to fightthefines.com, fightthefines.com, tell us the details, and if we think it's egregious enough to fight, we will indeed get a lawyer and take it to court.